Wabasha, Nuwajo, Koniwala, Nuwasuma Waeda.
Well, frankly speaking, thank you for the question. I would say that the government has shown that they are not sincere and they are not even negotiating well with the doctors, with NMA, for the suspension of this strike. So the responsibility, the issue on this strike lies greatly on the government because they have not shown any sense of sincerity. Thank you. You see, we embarked on this strike in July, on precisely July 1st. And the demands are so clear. We had a 24 points demand that the government should meet up to. However, in a very, if I say in a country that is actually and ready to serve the people, a government that is ready to serve the people should at least walk up to some of those demands. But however, I can say authoritatively here that the government has not shown any form of sincerity. They have not shown the doctors that they are ready, that they are actually ready to negotiate meaningfully with the doctors for the suspension of this strike. Well, NMA, the last time NMA embarked on strike was maybe sometimes in was it last year? Just 3 days one strike, and then after that, NMA has gone further to engage the government, to tell the populace, the society, that this is what the doctors are facing in this country, and yet no meaningful response has been given to the doctors by the government, which led to this painful call of the members to go on strike. Be that as it may, I want to tell the Nigerian people that doctors are human too. Doctors have families. We have wives, we have children, we have aged mothers, we have uncles, we have relatives around, and we also seek health care in our hospitals. Doctor, this strike is really for the people of Nigeria. The strike is for the healthcare delivery to be good. This strike is for the people of Nigeria. It is not a selfish strike. It is not a strike that is because that doctors want to go in just for going on strike sake. It is a strike that is for the people. For example, we are talking about National Health Insurance Scheme, coverage of 100%. The government has said that it is only 30%. And we are saying that everybody is entitled to this. And we have, in one of our 24 point demand, it's 100% universal coverage of healthcare. And this is for the people. We are also saying that in an hospital, a consultant physician, a consultant doctor is supposed to be seeing the patient. We don't want mismanagement of patients by other professional groups. We don't want a patient to come into the hospital and we not know the actual person to be seen, which is a consultant. A consultant is that person that has a relationship, a direct relationship with the patient, that the patient sees, and the consultant diagnoses the condition and henceforth commence on management of the patient. But in a situation whereby there are various consultants in the hospitals, the patients will be confused and this will cause chaos. And this is also on the part of the people. We doctors, we are passionate about our job. We know what the people want and we want the best for the people. This strike is not all about the doctors. is about the people of Nigeria. Yeah, it is practical. It is practicable. For example, in 2012, we actually asked the government that there must be a salary structure for all doctors at all levels to the local government level, that there must be a universal salary structure for doctors. Doctors have grades. We have specialties, and those specialties have been taken care of by the consolidated medical salary scale. What this is going to achieve is that a doctor working in Lagos will not be at a disadvantage to a doctor working in Rivers State. A doctor working in Lut, for example, will not be at a disadvantage to a doctor working in General Hospital in a Lagos hospital. What we are saying is that there must be that level of uniformity among doctors. If you're a doctor on grade level 12 in Lut, you should be earning the same salary with a doctor on grade level 12 in a Lagos State government employment. Because these doctors, they eventually go to the same market. They eventually live almost in the same area. You understand what I'm saying? So it will not be practicable if a doctor in Lut is earning on the same level, is earning higher than a doctor in a state hospital. So that is why we are saying that there must be a universal applicability, and it is one of the 24 points demand. If you look at those 24 points demand critically, you see that we have emphasized it, that there must be universal applicability. And what we are saying is that it is not until when the federal government is saying this is what they will do for the doctors at the federal level, and the states will not be carried along. What we are saying is that it must not get to that point whereby the state doctors or the state enemy will call up his members for a strike action. So we must achieve that universal applicability. That universal applicability is sacrosanct. Lagos State or your state, all the states must be paying same salary for their doctors. Well, Ebola as a disease, it's something that comes as epidemic. Its enemy at various fora has been talking on the issue of Ebola virus. And we are saying that this is one of the problems with the Nigerian government. For example, we are talking in the 24 points demand. We have asked for an hazard allowance of about 100,000 naira per doctor. Some people have said that is too much. But when you look at it critically, for example, this Ebola virus we are talking about now, a doctor in Nigeria, as of today, earns 5,000 naira per month as hazard allowance. It is something we should ask ourselves. Is 5,000 naira enough to take care of Ebola virus by a doctor, for a doctor? Look at look at the United States, for example. The doctor Brantley, I'm not too sure of the name, contacted this virus in Liberia, and you saw how he was taken care of. He was flown in a plane from Liberia to the United States for proper treatment. In Nigeria, we are not sure whether the government is ready to take care of the health workers, not only doctors this time around. If there is an outbreak of Ebola virus in the hospital, of recent we have heard the news that the doctor that treated the Liberian guy has contracted the disease. And I don't think the government may be ready to take good care of this person. The families are there. The relatives, the families are there. And if in this type of station, this doctor's welfare, the doctor's hazard allowance is not taken good care of, then we should ask ourselves, put yourself in my shoes. Will you be readily available to work and fight against Ebola virus when you are not certain of what might happen, even after you have contracted the disease or even after death? Ebola virus is a very virulent virus. It is not something that should be managed at even the secondary. It is something that should be prevented from spreading. It is so virulent that the mortality rate is between 30 to 90%. It's a virus that was discovered in 1967 in Zaire, and the case is so high, and the only way around is preventive, to prevent the spread through contact with patients. The major route is from excreta of patients, prolonged contact with the patient, and fluid or blood from the patient. In this situation, the enemy has gone all out, has been on radio, has been on television, counseling people on how to prevent Ebola virus.